ASD. Oops.
Don't forget to mute your phone, Crystal.
All right, so 23 of you guys got it correct. I'm not entirely sure how the team still works. So let's take a look on this question here. Lucky, G, Ricky, big number, and Dreamy. Good job there. Uh, so this was question 28, autism spectrum disorder, ASD. Explanation: while the child's behavior might seem obsessive compulsive, the broader pictures of social difficulties and communication challenge points more towards ASD. What's the difference between ASD and Asperger? Anybody want to chime in if you
What's the
remember?
question? What's the question?
Asperger. What's that? Like a is a let me see, Asperger.
So with Asperger's, I think it's all that condition is also on the ASD spectrum. However, these
Mm-hmm.
are high functioning kids. They don't really have developmental delays, but in
Yes,
terms of speech, the issues that they struggle with is communication.
you absolutely nailed it. Okay, absolutely nailed it. Good job there. All right, next question. Hmm. It's a hard question, wasn't it? Okay, this was a hard question. So here we have someone with acute mania, right? Rapid stabilization is crucial to prevent harm to the patients or others. What does it mean? Well, who has titrated lithium before, right? It takes a little while. Do you want to keep this patient in the hospital while you titrate the lithium? Or maybe you want a small dose of antipsychotic to begin with. Remember, that's like one of my pet peeves is when I'm dealing with bipolar, especially bipolar 1, right? I like to do it two ways. I like to cover for the ups and I cover for the ups mania. What I mean by that, with the antipsychotics, and I cover for the lows with a mood stabilizer. Usually, Lamictal would be a great choice, right? So quatapine is an excellent choice. Geodon is a good choice. Latuda is a good choice. Acenopine is a good choice. These are all what I call the skinny med. Not all, but most of them are skinny meds. But starting with the lesson pain is a great choice just because it works. But it comes with a little extra side effects, right? Who can tell me the difference between bipolar 1 and bipolar 2? By the book, like what defines what's the breakthrough
Bipolar,
between 1 and 2?
bipolar 1, uh, both both have manic episode and depressive symptoms. The difference is the time frame, the time that's okay. For that bipolar 1, it's within 1 week, 1 week, and for bipolar 2, it's within 4 days. And then that's basically the time frame we gotta pay attention to.
Okay, that's absolutely correct. Just want to clarify that one more time. So for bipolar 2, you have to have a depressive episode. Bipolar 1, you do not need a depressive episode. It can come with, and most of the time it does, but you don't need one.
Okay.
So once you cross the 4 days, then you can call bipolar 2. Once you cross the 7 days without sleep, energized, then you can call bipolar 1. Now, the if you are in clinicals and you want to really shine, instead of asking your patient, have you felt, have you not slept, or along those terminologies are vague, because I can be like, I haven't slept in 36 hours, right? And if I don't ask more questions, kind of doesn't give me a lot. Why is that? Is that because I'm having trouble with my spouse? Is it because I'm working on a project, right? But the best question would have been, have you not felt the need of sleep? Or have you slept and still felt energized? Have you slept only for a few hours at night and woke up super energized? Because that's different than insomnia, where you can be getting maybe 4 or 5 hours, but you're that tired when you get up. Those people with bipolar, they are super energized. Okay. Great question. Great answer to that. Thank you for collaborating. Okay, it's going to be a great question. Okay, for in general, for the principle of this question is going to be a great one. I'll explain how in a second. Oh, here we go. I don't need to. But what is interesting about this question is not exactly the content, but what it said. The person has been stable for 6 months. Any time for any type of question, if you see that the patient has been stable, then you have to ask yourself this question: what has changed? Okay. So if the patient is stable on a medication, antipsychotics, mood stabilizer, SSRIs, SNRIs, any medication, and something has changed, it's likely the test makers who want you to see or look for the change rather than increasing the dose, switching the dose. Those will always be options there. Increase the dose, change to another medication, add something else to the dose. But what they want to see is what other medication in case of the recover. For example, you are on Lexapro and perhaps prednisone was added to it because you had an infection, right? So you have to recognize the prednisone was added. If it's on a test and they specifically say prednisone was added, then your job is to increase the Lexapro, right? But if they don't have, all other options would be to collaborate with the PCM. So you have to recognize that something has changed. And that's why I kind of like this question. Just recognize that something has changed. In this case here is, hey, what else changed in your life? Okay, great. What is kindling? Can someone kind of remember what kindling is?
I remember, but I may not be able to explain it very well. It's kind of like memory cells. When
Like-
I don't know what was to use, but like when your brain noted that you have experienced seizure before, then the next time it kind of supercharged the response or something like that.
You absolutely explained it very well. So it's like a traumatic event, right? So it happened, and now it's about to happen again. How you think the person is going to feel? Super tense. I like to think in a different way. You absolutely nailed it. When I jumped from helicopters or airplane the first time, I said, hey, if this guy next to me can do it, I can do it, being the man that I am, right? And then the following jump, I was not feeling that well about it because I knew it's going to hurt a lot, right? So it's the same thing. Once a brain has a seizure, now with the decrease of alcohol intake, right? That's why it's dangerous. Alcohol, if someone is alcoholic, they drink extra drinks and they stop drinking, the alcohol lowers the seizure threshold, right? What other medication lowers the seizure threshold?
Wellbutrin.
Well done. It was about 5 weeks ago. I was on call. I do calls in my hospital, and someone was admitted for alcohol withdrawal. It went to the med surg unit, then it came back to us. And then the psychiatrist, he started the patient on Wellbutrin. And I was just scratching my head, and then I give him a call. But like, hey, are you seeing something that I'm not seeing? What's the reason? And now he's totally didn't think through the case, right? And they started the person on the Wellbutrin. I'm like, out of all the drugs you could pick, you picked Wellbutrin. So we have to be careful. We don't want to hurt anybody. Okay, we definitely want to be there to help them out. Thank goodness. And other things like I had someone on Wellbutrin, stimulant, recovering from alcohol use disorder in the past as well. Perfect storm combination, right? So we have to be careful. We have to know our meds. This is serious business. Okay. You probably remember when you made the mistake in the past, how you felt. Now you are the provider. That chance of you making the mistake again is kind of bigger, larger, more likely to happen. Unless you really focus on the principles that you learned and apply it. And when in doubt, I ask questions all the time. I'm known to ask questions, and I don't care how people feel about it because I really want to make sure that everything is well explained. I have two psychiatrists that works for me and have other nurses. I do ask questions all the time. I'm like, hey, why are you doing this way? Can you help me better understand? Rather than throwing rocks and say, hey, why did you do this? Or even if I don't understand something, I ask questions. So never be afraid of asking questions. Okay. Oh, I'm so sorry about this question here. Kind of, oh, the time is okay. Okay, great. So everyone got this right, mostly of you guys. If you did pay attention, this is super high yield. It has to be in two different settings in order to be ADHD. Okay, same thing with autism. A kid cannot just be autistic at home or at school, right? So something else, what other scales can we use to help assess for ADHD? Can you guys remember the scales?
So the
There is-
mood,
One person?
You said ADHD?
Yeah, what scales?
Connors?
Connors? Okay, is Connors paid or is it free version?
I believe
It's free.
free.
Okay. What's the other scale?
Vanderbilt.
Okay.
I think
Connors.
Vanderbilt is the free one and Connors is the
Oh
paid
yeah.
one.
Oh.
Yeah.
Yes. Well done. Well done. So
M-Sharp.
Vandenberg, you can download the internet, and the other scales you have to pay for. Now that's important. Okay. I don't know why it's important, but always come back on tests. And that's why it's on my presentation, right? Also, another one that's important is the MMSE versus the SLUM. Remember, those two scales are for cognitive assessment of whom? Alzheimer's dementia patient. MMSE is also known as the Faustin test, which is also you have to pay for. The SLAM, which is a St. Louis University scale, you don't have to. It's free, available online.
There's also the brown scales, and that is something I think you have to pay for.
Yep, the brown scales. Yes. Oh. All right, this one was pretty easy, right? Hopefully, you guys are getting this. The questions are being repeated on purpose so we can nail down those subjects. Okay. So remember one thing about ADHD, I've been knocking on this for a long time. If you have a kid with ADHD, you give a medication, the medication works until noon, 2 o'clock, but the kid kind of digress after that. It's going back to the old behaviors. What you can do, you can either give a larger extended release dose, but the preferred method is to add a immediate release small amount after lunchtime. ADHD is super important. If you fix, right, ADHD, but the kid is not gaining weight, not eating, that's not good. Okay, always do your measurement. The other question that people get tricked a lot, ADHD. Mother comes back and says, wow, what improvement. I love it how things are going. However, develop a tick. You have to stop ADHD medication, stimulants. You have to stop the stimulant. I'm sorry. Okay. Don't get question will make it seem that it's okay, but it's not okay. You have to start a non-stimulant like medication, like guanfacine, clonidine, Strattera, among others. Okay. All right, so it's the hyperactivation or hyperactivation of the prefrontal cortex, right? That is the issue with ADHD. But think about it, that's if you think about the stimulant, right? When you stimulate something, so it kind of you almost can make a deduction or reasoning that if you want to stimulate something is not being stimulated and therefore arrive uh, to the answer that it is a hypoactivation of what? Impulsivity of the prefrontal cortex, right? But there are other brain parts too that are involved, okay? Okay. I had hopes everyone would get this question right. Hopefully, some of you guys that missed today was due to pressing fast the button there, right? So someone with ADHD, you want to look for a stimulant. Ritalin is a good choice, especially XR, extended release. What else? Good, that's it. Okay. All right. Kind of not a fair question there, right? This is a probably a bad question, but atomoxetine would be a good answer. Okay, so that's why it was not a fair question. It was the incorrect question. It would never be on your test like that. Okay, so I do apologize for that one. You could choose atomoxetine as well. Okay, it's not only guanfacine. Just to want to clarify that. Okay, very good. So if you have someone that's an adult and you are concerned about substance use disorder, you're concerned of abusing stimulants, which stimulant can you also prescribe that carries a little bit less of a risk?
Vyvanse.
Vyvanse. Do you know why? Or kind of? Because the way it is, go ahead, please.
Would I say it's less potent?
No, but along those lines, but the way it if it only digests in your stomach, so it cannot be snored, break. I mean, it can be snored. It's just not going to be. They won't have that much of a high compared to other stimulants, right? The way the enzymes break down of the pill specifically, the chemical composition of it is to be digested by the stomach. So carries a little bit less of a risk. Do they still do it? Yes, they still try. Okay. but it carries a little bit less of a risk. So if I'm concerned and I still want to prescribe it, then I would go with Vyvanse. Now, maleficence, right? The ethical principle I want you to really ingrain in your head is when you take it away, a medication due to a possible side effect. If you withhold benzodiazepine, if you take away trazodone because of priapism, that is the principle of maleficence. Okay, so we covered this in the crash course review, but it's a hard one to remember unless if we talk about it more often. Okay. Remember those ethical principles, they are easy questions, right? Easy question comes with hard, easy concepts comes with hard questions, oftentimes. Okay, perfect. You guys nailed it. We are going over simple concepts, most of them related to ADHD today, just to make sure that that topic is solidified and we're good to go. Okay, so a lot of similar concepts we're going over. Okay, perfect. Remember, when you are assessing someone for ADHD and the mother gets distressed during the assessment or when you are exposing the mother to your findings, you have to stop the therapy. And now your focus is on the mother and father rather than the child. So provide brief support therapy to the parents. Okay. So since I talked about vitamin, what are the two vitamins that is related to Alzheimer's dementia, should I say?
Vitamin B12. Oh, wait a minute. No, vitamin D.
B12, no, B12 and folic acid.
Okay, B12 and folic acid. So anytime you have someone with dementia, your brain should be immediately looking. Let me go ahead and put a B12 and folic acid. Good job there. Just to rule out. Okay, perfect, right? So here we want to provide parents-child management training, right? Very, very important. It's super hard to deal with a child that has ADHD. So oftentimes the parents don't know how to, right? So they need the training rather than saying, you're on the phone and talking to your friend, and then you yell, say, "Hey, Mia, go take a shower," and go back to the phone. That's not gonna work. You have to stop. Look at Mia and say, "Hey, Mia, in 3 minutes, you need to take a shower. Do you understand?" Eye to eye contact, strong direction. And then in 3 minutes, you have to come back to me and say, "Your time is out. Please go take a shower now." Okay, if the mother is yelling, the father is yelling, go do X, Y, and Z while the child is playing or watching TV, that doesn't even work with with the regular children that don't have ADHD, much less with those that do have ADHD. So parents training is super important. Okay, what other conditions do you remember that parents and child training is highly indicated for? Any other condition?
ODD.
ODD.
ODD, okay, ODD, and you can even throw in what else?
Conduct disorder.
Conduct disorder.
Conduct. Okay, so please write that down. ODD, conduct disorder, super high yield information. Okay, perfect. I figure that some people would get confused, borderline and bipolar, right? So don't get confused in terminology. Also acknowledge that patients will say, "Hey, my mother is bipolar." And then you have to say, "What do you mean? What is bipolar to you?" Right? Because if you get it wrong, it could be very dangerous. Okay. When you assessing for bipolar, always look for familial history. Okay. Very strong. Bipolar, ask, is anyone in your family with a history of bipolar? For two things. One, if the patient comes in depressed, you want to make sure this is a major depressive disorder or a depressive disorder of some kind. But if you are going to prescribe an SSRI, SNRI, or any other antidepressant, you have to make sure it's not bipolar in depressive episode. Point number two, if someone has a bipolar and shows up in your office in depressive episode, you cannot diagnose the person with major depressive disorder. The diagnosis is bipolar disorder in depressive episode. Okay, so that way, if the person goes see somebody else, they don't make the mistake. Okay. All right. Good job, everyone there. Anytime you hear mood swing, what kind of questionnaire are you looking for?
Mood questionnaire.
Okay, mood swing questionnaire. Okay, so anytime you hear libile mood, look for an answer that is a mood swing questionnaire. It was definitely misleading here, right? In fact, it could be both, right? It could be mood stabilizer and an SSRI. Okay. Now let's talk about this for a second. So there are some reasons, or some, if you are picking a mood stabilizer, okay, so you could do SSRI, but you could also do a mood stabilizer. There are two mood stabilizers that you can use for borderline personality disorder. So the question was not a good question.
Can I have a question?
Yes.
I guess my rationale for picking the mood stabilizer was to manage the impulsivity.
Yes, you are right. So the question was not a good question. Okay. Because there was two answers to the question. So it could be mood stabilizer. But now I'm trying to go a little bit further. Which mood stabilizer? Right? So
Like you use lithium,
lithium and
Depakote.
Depakote. But when and how? How
You
do you
use them.
distinguish? Yeah, like for which symptoms you would use one versus the other?
Manic, you use lithium.
Sure. Manic, you use lithium. Okay, so let's go that route then. So when would you not use lithium?
Let me make the difference. The difference is you use lithium if the patient has suicidal threat and agitation and suicidal. You use lithium. You use the Depakote if the patient is not emotionally bad. When they say labile, the patient is labile, emotionally or depressed, you use Depakote. But if it's suicidal plus mood, you use lithium. Is the good one.
Okay. All right. So, okay. Oh, we are getting there. So, okay. I was going more towards the line of aggression right? So let's start by saying that there is no FDA approved borderline personality depression, borderline personality disorder. I'm sorry, medication. Let's acknowledge that. Okay. So because of that, we can manage the symptoms. We cannot fix the disorder. Okay. So for someone that is suicidal, we can use SSRIs. Now, if we are going to use Depakote or lithium, right, for impulsivity, we can use more of a lithium. Labile depression, we can use more of a Depakote. Okay. Now, be careful. People with borderline personality disorder, they do not want to die. They don't want to die. They want to help. However, they are almost the number one cases in which they have unintended suicidal death. You know, more for a cry for help, but they may have taken one extra pill and have those bad outcomes. Okay. Go ahead. What is your question there?
I'm so sorry. Can you repeat when you choose Depakote over lithium and the vice versa?
Okay. So lithium, if you have this aggression behavior, impulsivity, you could use lithium as one of the choices. Depakote would be more if you have a borderline personality disorder and they have this depressed mood, labile condition. Okay. So we kind of went over this a little bit on the crash course review. So now there is no FDA approved medication, right? So we're only managing the symptoms here. Now let's go back to the same medication, the same two medications. Let's look at lithium and Depakote. Now let's look at bipolar disorder, different disorder. If you have rapid cycling, would you have a different mood swings very fast? Do you use Depakote or lithium?
Lithium.
Vote. Depakote.
Lithium.
Okay, Depakote. Rapid cyclic, no lithium. Depakote. Okay, so that's important, especially for clinicals. Okay. Lithium is very good for the manic state, not so much for the depressive state as well. Okay. All right. So this one was a bit difficult, right? Let's take a look here in the rationale. So avoided personality disorder, right? So they basically avoid, right? So it's characterized by the external social inhibition, feeling of inadequacy, and hypersensitivity to criticism. Who else is hypersensitive to criticism?
Is it phobia?
Say it again.
That phobia, I can't. It's a type of phobia.
I was thinking more of a personality
Narcissism.
disorder.
Oh,
Borderline.
personality.
Borderline.
Narcissistic,
No, oh
right?
yeah.
Paranoid.
Why? Yeah, narcissistic. Who are the narcissistics? Are those that wants to get accolades even though they don't deserve, right? Oh, I am the best person in this company. If I leave, this company will go down, right? They feel like they are the best thing ever, that no one can do their job, right? If they give it a report and they receive some criticism, oh my, right? They always correct. The narcissistics, they always correct. They are the best thing ever. So they're very sensitive to criticism. Okay. Now let's take a look here. Few more things, right? Uh, when do we look at Depakote and lithium, right? I mentioned rapid cycle, right? So Depakote and lithium, they both used for bipolar disorder, right? So when it's rapid cycling, however, they have different mechanism of actions and potential side effect. If you say Depakote is considered the first line treatment for rapid cycling, and you have to wonder why. And that's due to its effectiveness in established mood swings. So lithium doesn't work as well as Depakote for rapid cycling, right? Depakote helps reduce the frequency and the severity of manic episode and depressive episode. Lithium is very good for the highs, for the manic, but not so much the depressive ones. That's why I like to cover lithium plus, I like to cover like an SGA, second generation, plus a mood stabilizer for the bottom or for the depressive episode, like Lamictal, right? Another thing with lithium, you have to be very careful and go up very slow. You have a high fatality rate if you pass above 1.5. Not really. In real life, we see it all the time at 2, 2.3, 2.2. But I am getting scared at that point. Okay. So you have what we call the narrow window of adjustment at 0.6 to 1.2. Remember, 1.3, you assess, continue to assess. If there is symptom, you stop. But if there is no side effect symptoms, you continue. 1.4, you don't stop the medication. You continue to assess. Lithium, you see a 4 plus urine protein on the urine, you don't stop. But you are very careful now because you know there is kidney injury. Okay. Let's talk about a few things. What are the two side effects that we guys remember from Depakote? There are FDA warnings for Depakote.
Liver damage.
Pancreas.
Yeah,
Hepatotoxicity, pancreatitis.
Yes, so liver toxicity and pancreatitis, right? What are the two FDA warnings for carbamazepine?
Granulocytosis, I can't even
I
talk.
Granulocytosis,
And a plastic anemia, sorry.
plastic anemia added. Yes, so a granulocytosis and the plastic anemia. Okay, so one person. Yes,
Dr. Lopez, I have a question. How
sure.
do you differentiate the anti and the social anxiety disorder with the AVPD, avoidance personality disorder? How do you differentiate?
So the
also?
avoidance, you are going to look more for things that like, I don't want to have no confront. I don't want to confront anybody. I just want to be on my own and totally totally avoids. What's the other one you mentioned?
Social anxiety disorder.
Social anxiety disorder. Is that right?
Yeah.
Social anxiety disorder is the one that only not it's afraid of rejection. Okay, it's what people's gonna think of me. What if I make a mistake? I don't want to give a presentation. I don't want to be part of this because what people's gonna think of me if I don't read it correctly or if I don't say something that's right. That is more in line with a anxiety disorder. That falls more of an under anxiety disorder. And when the avoidant personality disorder is a personality issue rather than a neurochemical imbalance. Let's put that way. Okay. Did that help a little?
Yes, thanks.
All right. So it's a grandiose need of I think it's a grandiose needs of accolades or something along those lines, right? So that falls into narcissistic, right? Needs for accolade, grandiose is admiration. That is what's said, and lacks of empathy. Who else lacks empathy? Remember, conduct disorder, right? Cruelty to animals and lack of empathy, lack of remorse. So is antisocial, uh, antisocial disorder, right? So, narcissistic and antisocial disorder, they share the most in common. So sometimes it's hard to really say, is this an antisocial or is this more of a narcissistic? And sometimes it kind of like the lines get really blurred, especially in real life to distinguish that. In paper, it's a little bit more easier. So sometimes what I like to say is cluster B. I don't call it right away unless if I'm really sure. Let's say cluster B traits recommend this type of therapy. And sometimes it's actually good to call it out because the person is like, oh my God, now I understand.
Coach, can you build?
Yes, you definitely can build.
Okay.
All right. So this is a good one, right? So here we have schizoid personality disorder. So what is the difference between schizoid and schizotypal? Anyone guess and kind of want to take a stab at this one?
Yes.
Go ahead.
Schizoid, they look like schizophrenia. They share hallucination and delusion symptoms, while schizotypal, they have no symptom of hallucinations. They may have paranoia, but they are like magical thinking. They think like, if something happened to you, it's because you were thinking about it. That's what's happened to you. They're like pre-operational kids, and yeah, that's basically how I understand it.
Okay. So what is schizoformal?
Uh, schizo Schizophrenia is basically it's kind of similar to schizotypal. They
Okay.
they present the symptom of they see things different. I think it's the time frame. It's if I remember, it's the time frame between schizotypal and schizophrenia.
Thank you. I appreciate the call in. Can somebody else raise your hand? Can somebody clarify that a little bit more?
I just wanted to say that I feel like schizophrenia, the one, the P, phrenia, the one you just asked, the last one.
Okay, schizoform. Okay.
Yeah. Yep, that one. I just feel like that one's more like it has like minor like hallucinations and stuff, but it only lasts for like 2 weeks and then they go back to normal.
A month. Okay. Okay.
Or a month.
So let's clarify some of this. Okay. Let's see schizotypal versus schizophrenia, schizoid personality disorder, schizoid versus schizotype. So both of them are classified as cluster A, right? These are personality disorder. They both have eccentric or odd behavior. However, they also have few difference, right? So when you say schizoid, what is the core features of a schizoid? Right. Schizoid is detached from social relationships and limit emotional range. So it does, hey, you did a great job. They just look flat. Wow. Can you improve on this? They just look flat. Completely limit emotional range, right? So schizoid, other symptoms, they lack interest in social relationship. They prefer to be alone. They have limit emotional expressions, uh, difficulty forming close relationships. What else? Indifferent to praise or criticism, and no desire for intimacy or sexual experience. Schizotypal. I want you to think of the guy that puts a tin foil on his head. That's like more eccentric, more odd. Okay. They are peculiar thoughts, perceptions, and behavior, along with social anxiety and discomfort. However, they have like these more difficult, they have these more odd beliefs and magical thinking. Okay. Unusual perceptual experience, eccentric behaviors, social anxiety, suspicious and paranoia, inappropriate or constricted affect, and they may have magical thinking. Now, I would not say as far as hallucination, okay, but getting there. That's the only thing I would disagree with my friend that just mentioned that they'll have odd behavior, but doesn't get as much as into hallucination. They may be paranoid, suspicious, right? Now, schizoform, right, is that one that has the like hallucination like symptoms, but for a shorter period of time. Okay, it doesn't quite make the brief psychotic. It doesn't make the schizophrenia like symptoms, right? But it's getting closer now. Okay. Hopefully that helps a little bit because I know those can always be confusing. They are not super high yield, but it's good to get a good hold of this because you see those in practice quite a bit. Okay, so wanted to mention something. Everybody got it this right. So I just want to clarify a little bit more. Uh, when you say schizoform versus the schizophrenia, how is it different, right? So let's think about this a little bit through because it's actually very close related. So when you say schizoform, you're really thinking, and schizophrenia, they both are psychotic. They both have psychotic features, hallucination, delusion, disorganized thinking. But what's the primary difference? How do you say one is versus the other? Let's start with schizoform a little bit. So schizoform lasts at least 1 month, but less than 6 months. The schizoform, schizophrenia form disorder. Okay, 1 month, but less than 6. Usually, here we have after 6 months, the symptoms may be resolved completely, or the diagnosis may change to schizophrenia or something else that might be. Okay, it can be other things that are going on in the brain. It can be a tumor. So over a month, less than 6. Schizoform. Schizophrenia, when you call it schizophrenia, like symptoms persist over 6 months or longer. Okay, so it's very chronic, ongoing management they're going to need. ACT, remember, keeping the patients out of the hospital in a community would be a great choice. Okay, so they can be similar. The only thing is the time frame. All right. So I just want to clarify that because uh, uh, one of our colleagues that said 2 weeks, and I didn't make a note of that. So over a month, but less than 6, schizoform. More than 6, schizophrenia. Okay. Any questions about that? It's not important for the test, I don't think, but it's important for you that you will be working in the clinicals to call it correctly, right? Then you ask, how do you know if it's 6 months or not? Well, we're gonna have to do some investigation there. Gonna have to get some information from history, from the family, from the chart before you call it straight up schizophrenia. And remember, very important for the test is the time. What do you mean by that? Well, the age, should I say, not the time. If it's the first breakthrough, males, right? 18 to 25. Females, you add 10, 25 to 35. If it's like really outside the range, and you get a call from the ED and says, I think I have a schizoform or schizophrenia patient, Family reported that has never seen the patient this way. And I think this is the first breakthrough. And the patient's 55 years old. You gotta be thinking, is this a drugs, most likely, followed by maybe a tumor? Not that it's impossible to be schizophrenic, it's just way out there, would be extremely odd, never seen and never heard. But I would never say that's impossible either. Okay? So you got to be thinking of something else. Discomfort in social situations, odd beliefs, unusual perception experience, eccentric behaviors, peculiar mannerism, and speech. What does it look like to you? Okay, well done, guys. Yeah, schizotypal. Remember the guy with tinfoil on his head, eccentric, magic thinking. Is a personality disorder, is not schizophrenia disorder. So for personality disorder, you are not to give an SGA and FGA, right? You are thinking, hey, it's therapy like. You are not going to start a antipsychotic for a personality disorder, or at least would not be the recommended course of action, or at least not initial. Treatment here would be therapy. What kind? Cognitive behavior therapy, CBT. So frequent questions, the loyalty of friends and acquaintances, and is often preoccupied with doubt about intentions of others. Okay, well done, everyone. Um, hopefully, maybe once I highlighted the for you, you have to ask yourself, what is the core of the question for every question? And then you go back and start highlighting on your test. There is a marker you can strike through, and there is a marker that you can highlight. So I like to read the question, and then I ask myself, what is the core of the question? Then I get my highlight, and boom, boom, boom. And then I'll look A, B, C, and D. Okay. Never jump to the first one, especially A's. A's usually a close answer that is the distraction, usually, right? Not always. Many right answers will be A, but you have to be suspicious that we know we want to put a close answer to the right answer as A, because we know some people will jump right through it and move on to the next question without reading the rest of the answers, right? Some people will do that. It won't be you, but some people will. Okay. paranoid personality disorder exhibits the classic symptoms of a PPD, right? Such as pervasive distrust, I'm sorry, suspicious, sensitivity of perceived slight, and questioning of the loyalty of others, right? So they always suspicious. That's what makes it paranoid personality disorder. I had someone recently that I went to see in a hospital, and she she went out on Friday night, so I saw her Saturday morning, and then she went out, and then she met some guy in the restaurant. They went home, right? The guy passed out drunk, and in the morning, and she too, nothing happened, right? They slept there. In the morning, she woke up and she started freaking out. What this guy's doing here? How he got here? This her apartment, and then she called the police. So the police goes there, and the guy's, hey, I just slept, and then he just went home. That's okay, but the police brought the patient to the hospital, and while I was at the hospital, I already know this patient, and I already had requested some investigation about this patient just because this suspicious behavior. So I already know of the patient, and then I went to talk to the patient, and the patient's like saying things like the stroller has some microchips that tracks everywhere she goes. That she thinks the government is tracking her every step that she does. She doesn't trust anybody. Very, very paranoid. Now, half of the people in AD is saying, are you going to let her go? Or are you going to bring her to the unit, right? To be admitted. So then you have to ask yourself a question. Is she dangerous to herself or others? She is not. I asked, what are you going to do once you get released from the hospital? She said, I'm going home, clean my house, get ready for Monday coming up, right? Can you call a friend that you trust to be with you to make sure that you're safe? Yes. At that point, just because she's paranoid, it does not give me the right to admit the patient against her will. Okay. But it is a difficult scenario because you clearly see that she's very, very paranoid. Yet, respecting the patient's right and understanding some legalities that involved what if the patient get hurt. Well, there's what ifs in many cases, right? But admitting someone against their will, you have to have a strong reason for that. And patient declined, did not want to be admitted, did not want to start any medication. So my only resource is to let the patient go, provide as much of a brief therapy. But do you think she wants to listen to someone that she doesn't trust? She doesn't, right? So how good is what can I do in that case? I can only provide some comfort, assure the patient that she will be discharged, and go on, right? Yes. What's your question there?
Um, one, can this be confused with schizophrenia?
Yes, absolutely, right? But how would you differentiate, right? It can be very confused because paranoia can be part of schizophrenia, but you have to ask, not all symptoms of of a paranoia, not all people that have paranoia have hallucination. She doesn't have no hallucination. She doesn't have any of the other symptoms, disorganized thinking, right? So you have to really think, is this paranoid personality disorder or is this schizophrenia? Schizophrenia is way more severe than paranoid, but it does. And that's why half of the people in AD is like, you have to admit her. I'm like, I can't. If you want to, that's on you, but I really can't do that. And by the way, I don't want her to be admitted because I'm on service too. So, you can't admit her. So hopefully that helps. Yeah.
So if she's not experiencing like hallucinations and like auditory hallucinations, then that can be ruled out that she's not schizophrenia.
Yeah, you can see it that way. Absolutely. Disorganized thinking, right? History of the past, been admitted in the past for the same thing, for paranoid. Um, many, not many, well, it is many, sexual assault uh, cases, right? In which she has accused 3 other persons of sexual assault as well, right? And that's why I was think, wow, luckily this person kind of slapped and nothing happened. We don't have to deal with the sexual assault case, right? Uh, but it's very difficult because, um, when you have those types of investigation, you really want to be. You cannot just say, "Oh, she's paranoid. It didn't happen," right? But at the same time, you have to really be careful because there is a lot of things that can happen, right? So it's very difficult to investigate. And it's not my job to investigate either, right? I can only relate the information, I will relate to authorities and let them investigate, right? Uh, yeah.
Okay. Thank you.
Thank you. Good one. Okay, actually, very good, guys. Very good. I have a story about this one. Um, During my clinicals, my third year, I went to a different city. I left my family where they were in Maryland, and then went to North Carolina alone. So we did 2,500 hours of clinical for the last year. And my roommate, because I wanted to have a roommate where I was at, was a highly successful person, a high ranking person, but he had obsessive compulsive personality disorder, right? But I couldn't really tell him that straight up. And after we got along and everything, I just opened the book, the DSM-5, and said, read this to me, you know? And it's like excessive stinginess or excessive uh, controlling of projects in a point in which he would be late in delivering the projects because he's so concerned about being perfect, excessive tightness, make sure everything is right and correct, excessive and keeping old things at the house to the case that would cause impact on his marriage. And he's like, "Are you pulling my leg?" I'm like, "No, no." It's like, "This is me, totally." But I never said that. I just asked you to read. But he recognized by the DSM-5, he met pretty much all the criterias, right? Now it can be very difficult because this guy's way well off, right? But he's so stingy that is like, wow, it causes distress, unnecessary because it doesn't need to be that way, right? At all, right? Uh, Keeping old things, not let having difficulties to let it go of material possessions, just keeps everything for many, many, many years. It's almost like hoarding things, right? So I thought it was funny because it's like, yeah, this is totally me. What do I do? I was like, you probably need some therapy. This one's pretty easy, right? Long-standing patterns of submissive and clinging behaviors. Fear of separation from loved ones. Has difficulty making decisions without excessive advice and reassurance from others. Okay, we are almost 100%, guys. So I can see why some of you guys would think this is borderline, right? But not does not mimic narcissistic. If anyone want to help me understand a little bit better what why you thought this was a narcissistic, it's okay. If not, that's totally okay as well. But this is a very clear case, what's clear as it can be, of dependent personality disorder. Okay, believe me, it's a lot better when we make mistakes here. Okay, and it's totally fine. This is the time to make mistakes. This is the time to learn. Okay, okay, moving on. So difficulties with social interaction. Avoids eye contact. Now it becomes a bit clear. Appears indifferent to others' emotions or interaction. He has a strong preference for repetitive activities. That was the key word, right? And routine. Gets upset when changes in his environment. So well done, guys. So that is a very clear ASD, right? They like a routine. Okay, please go ahead and ask your question.
What is the youngest age we can diagnose autism spectrum disorder?
Great question, right? I do not know the answer. I do not know what's the youngest age, but they can be diagnosed very early, because yeah, I would think maybe probably completely guess here. I don't work with children, adolescents. I would think maybe up to 3 years old would be, I would say earlier than 3, right? Because you will notice, hey, John, hey, John, John. John doesn't look, right? Because of the broken mirror syndrome.
Yeah, I think it's 3 because that's when you can also differentiate the parallel play.
Yep. But they listen to the parents. They just don't listen to others, right? They recognize the parents. So I think early, very early.
From what I have something to say here.
Yeah.
Yeah, from what I read when I was doing questions, it is more prevalent in boys than in girls. and
Very
then
important.
start screening for ASD from 18 to 24 months of age.
Okay, that's exactly right. Thank you for clarifying that. That kind of rings a bell. But it makes sense, right? Because you don't need that to much of a time to identify ASD. Now, thanks for saying that because it's more prevalent in boys than it is in girls. But what condition is more prevalent in girls than it is in boys?
Right syndrome.
Yep. Thank you. Thank you for that. Mm. Okay, very good here. Now, I want you to know the therapies and scales by the letters, by the acronym like ABA, because on the test, they may not give you applied behavior analysis. They just may say ABA. And it gets to be very hard, right? If you don't know what cars means or MChat means, right? So make sure that you are learning by the acronym and by the name. However, if it's for the drugs, you only need to know one because they always give you two, the the brand and the genetic name. Okay. Be careful with true answers that does not answer the question. Okay, so be careful with true answers that doesn't answer the question. So a great example here is the orange there. It says stimulants directly say that stimulants directly affect the function of the neural neurons in the brain, right? So we kind of put a really is not the truth, but we mix facts with incorrect facts here, right? We know that you guys know about the neuron in autism, and we add a little bit flair to it to make an incorrect answer. But oftentimes it could have been like an answer that's true for autism disorder, but it doesn't apply or doesn't answer the question. So be very careful with those answers. So here, stimulant medication modulates the release and reuptake of neurotransmitters, especially dopamine, right? And norepinephrine. within the place of within which plays a role in attention, focus, and impulse control. Okay? All right. So attention deficit hyperactivity disorder, ADHD, right? So that is the answer, the best answer there. All right. Next question. It's the last question of the day. Okay, well done, everyone. We got 100% on this one, so we are making some progress. I love to see when the class gets 100%. That means even though we repeated a lot of questions. So third here was J.E. Lillian, you got the second, and Yari, first place. So well done, guys. Good job. I think Lillian just joined our question bank. If that's the same, Lillian. Hopefully you got your password for the question bank.
Yes, I did. Thank
Okay,
you very
great.
much.
Absolutely. So guys, I know a lot of you guys enrolled very recently. So if I owe you something, let me know. Send me an email. Okay. If you don't know where to go for your question bank, please send me email me, please, so we can get you square away. Study hard. Okay. Leave nothing, no rocks unturned. Okay. This is your moment to shine. When you walk to the test center, make sure that you are good to go. Before we end today's event, we have two questions. Joe, is that right? I can't see your full name there.
Hey,
You
Dr.
have a question?
Lopez.
Hi.
Yes, I was just wondering. Like last Saturday, I went to a library. I was in a library and I met this guy who was talking about. He said he was in the military, but apparently he was charging his phone, and the iPhone stopped working. So he said that the government are always tracking him, so messing up his conversation with people and everything. Like he looks perfectly normal. He said while he was in the military, they chipped him. But with the chipping, is like every conversation he has with somebody is transmitting somewhere in a government office. And he also says something about like a star. When you are driving, you see a star, you know, kind of going, following that. You want to know is like I forgot what he called it, satellite following you. And then you want to make, like, if you want to know if that's following you or not, make a right or left. 2 minutes later, if he still appears, that's following you. Now this guy, normal, he looks good, and he's very intact with other normal conversation, but he strongly, like, he got me confused. I don't know, is there anything like government cheaping people, or he's psychiatrically something is going on?
Well, I cannot confirm or deny it. Just kidding. Just kidding. I don't know what to say. It can be, it sounds to me a paranoia, just like not to put a politics into this, right? A lot of people have strong beliefs that the U.S. economy is going down and that the dollar will be devalued. I know, like, a lot of people that like worked with me and they're like, the dollar is going down. You better buy Bitcoin, X, Y, Z, and they're fixed in this belief, right? Which may be right, or may be, but they are so sure that the conversation almost makes you think, what that I don't know, right? So it's, some people may believe that, and it's not too far out there. We know that we have done wrong to a lot of people, right? In the past. So, like, I don't want to get into a debate, right? But we have done things as a government that is not right. We have, okay? So there is a right to be suspicious, but how much of this seems way out there, right? So it's hard. It's hard to say. Kind of really needs to have a full assessment, because if there is that, what else is going on, right? You have to wonder, what else? Is it just the government, or are you suspicious of a spouse? Are you suspicious of your boyfriend? Are you suspicious of your daughter? What else is going on? There is probably a lot more going on. It's not just the government, right? But the government, people feel that they don't want to be tracked. They don't want to, like here in Korea, everywhere you go, there is a camera, and it's completely normal, and it makes it one of the safest place to live in the planet, right? You can leave your wallet outside, and tomorrow, more likely than not, your wallet will be in the same location, right? How cool is that? But it comes with a cost. What's the cost? There is CCTVs everywhere you go. So where does your liberty of not being tracked comes with a benefit and a cost? So it's hard, right? It's very hard to know if this is, I mean, to me, it seems way excessive, and that we need like a full psychiatric interviewing the patients to kind of really know. But often they do have those paranoia. They can be of distrust of their spouse, right? We have seen all of those. Oh, you can't look at my phone, always look in somebody's phone, because they don't have the trust, right? And then you have to wonder what happened in the past. Okay, thanks for the question. Poitier, is that right? Do you have a
Oh,
question?
sorry, I forgot to put down my hand.
Okay. Hey, Michael, you're here today. So congratulations, man. You just passed your board. So super happy for you.
Yes, sir. Dr. Lopez. Yeah, I'm very excited. and we're on to bigger, better things. And yeah, I thank you for your program and your support, and the support of my wife and my family. It is
Amen.
possible. Amen to that.
I know.
Is it okay if I say a couple of words to?
Yes, please, please go ahead.
Okay, I was going to say, guys, good luck with this program. And I just want to say that it really does work. You have to apply yourself,
Mm-hmm.
and you really have to put in the work. Nothing is easy, but if you understand, thank you, everybody. Oh my God. I see all the cheers, and thank you. If
Yeah,
you put
Mike.
in the work, you have to make sacrifices. And like Dr. Lopez said, this program is 6 weeks. For me, for example, if I sacrificed a lot for the following 6 weeks for this, and my wife was very understanding, my family was very understanding,
Yeah.
because I had one objective and one goal, and that was to pass my boards. And like I said, it is possible with this program. Grad school teaches you theory, not so much how to prepare for the boards. And this program is literally all you need to practice and to study and to pass.
Thank
You know?
you.
Yeah,
I am
absolutely.
so happy for that you say that. Few things that really I agree. I mean, I agree with everything Mike said, but a few things that he said in the past that really chimes with me. Right? He said that he was okay that his family would go out and that he stays home studying, right? Because that reduced his stress. With me too. When I took my GRE, I didn't do well, and that caused me so much distress that I said, "Hey, for every single day, when I look at data, I said, okay, why didn't do well?" It's very simple to do super well. Study a lot, you do super well. The more you put into it, the more you receive. And then for 6 months, I study every day, like big math books, big English books, every single day, 3 hours, 3 hours, every single day for 6 months. And then in the last month, I said to my wife and my daughter, here's your ticket to Disney, your hotels. I love you guys. Go have fun. Oh, Daddy, you don't want? Yeah, I would love to. But it was such a blast to be able to stay home and like really do something that I love, because I know it would be a big payout, right? It would pay out hugely for me. That's when I go from a nurse to a practitioner. And by not being at this thing, by not doing what's spending time with my family, which I love, but also it brought me a sense of calmness, that I went over there and be like, I got this. So, and stress, what is stress? Stress, anxiety. It comes from a lot of things. There is the amygdala overdrive, the amygdala, there is that component too. But a lot of stress, a lot of anxieties come from the fact that there was situations in you which you needed to do something, but you did not do. And that comes the stress. A lot of it. I know there is the amygdala, there is the GABA, underactivation of GABA, there is underactivation of serotonin, all that. We can go all into that. But what can you do on your own to curb the anxiety? Do what you need to do early. And then it will be much easier and you feel much more grounded. You're still going to feel a little anxious, and the anxiety comes from the feeling of unknown, right? But that's the first thing. Second thing is, I love that you said it, this is all you need, because truly is. And it's not that I'm kind of saying, my point here is this: if you are starting with something else, you are devoting less time to this. And if you are devoting less time to this, you're not giving yourself 100%. And I love other courses, and I think they are helpful and they can be helpful. But at least master this one completely before you decide to divide your attention. Yes, I want your full attention in it. I want your full dedication. I want you fully in it, because it's your greatest moment of your profession. It
It
is.
sure is, doctor. It sure is. And that you said it. You said it as well. If you don't discipline yourself and dedicate yourself 100% to any program like this one, for example, you are not going to succeed. If you feel that going on a date with your boyfriend, girlfriend, wife, husband is more important than staying home, then your priorities are wrong, and you are going to be stressing come closer to test time. That is why, like I said, and you said, 6 weeks for me was nothing because I knew that the payout was going to be big.
Right.
You know,
And Mike also said that he found our program on the last minute or something, that he initially had his board set up, right? Something along those lines. And then you
yes,
had to reschedule.
yes, I did.
So
I wasn't prepared. It was I had a surgery, so I had to reschedule, and I wasn't ready because I didn't have your program before, and I knew in my heart that I was not ready, and I didn't want to deal with that stress of being unprepared. So,
yes.
by faith, I found your program.
Oh,
Literally by faith, I found your program. And like I said, I know some of us are still in school, and this program is great to learn, to study. But those that are thinking of testing, do it. Dedicate yourself. Dedicate yourself. Set the date, because if you don't set the date, you're going to push it off and you're going to
yes.
become lazy. You will become
Yes.
lazy, complacent, and you're going to be telling yourself, oh, I could give it another week. The longer you push it, the more you're going to have to study. And I set my date and I stuck with it. And I mean, my wife is here too, and she'll tell you firsthand, I locked myself in our bedroom. Yeah, I locked myself in the bedroom. She was with me week in, week out, day in, day out. While I studied, she would watch her movies or do whatever she needed, but she was with me. Support is also very important, but I dedicated myself for 6 weeks. And when I took the test, I went in confident, scared of the unknown, but confident that I was competent enough to know the answers. The test was not easy because the questions are not what you think you're studying in this program, but in reality, they are. You just have to apply the knowledge and it will all make sense. But if, like I said, if you're thinking of going to the movies or spending time on a Sunday afternoon with your family instead of studying for the next 6 weeks, then chances are you're going to struggle and you're going
Yeah.
to be playing catch up.
Yeah. So I know you probably don't know this, but I called your victory like 3 days before I went on Facebook. I said, Mike is going to pass. I'm going to call it right now. And how do I know? You don't have social media, so you probably don't know this. You can go back
Yes, I don't
and I
have
said,
social
hey,
media.
yeah, I said, hey, look, this guy here, Michael, he's going to pass. And how do I know? Because I look at his score on the test too. And I said, Mike, there is not a chance no one ever not passed with above 80%, a
You did tell me.
true 80%, not a fake one. What's a fake one is the true. The true is the first time you take it, you get 80%. I have no concerns. Now, the only challenge that I'm going to give you is to be in the first 3 to 5 percentile of all test makers. I said, because you already passed. So now if you really want to get like to the 145 questions right out of 150, you're going to have to do X, Y, and Z in the next 3 days, right? We talked about that. I said, it's passing. You can actually go out today and have a dinner with your wife and celebrate because you already passed. I'm telling you right now, there is not a way that you would not pass. And I'm 99.9 confident because when I see your scores, like, yeah, there is not a way. Never happened. Right? Now, what's not a true score is when somebody has taken the test 3 times, right? Now it's invalidated. And that brings an important point. Time it at least 1 week before your test date to take the diagnostic test too. Because we can reevaluate things. We can look at your score and be like, okay, you need to learn a little bit more about adjustment disorder. Or you need to reschedule and give it a little bit more time. Second point is the first time you take it is your best chance to pass. The second best chance is the second time. Third time, it gets very, very difficult. Okay. So if you are taking the second time, it's totally okay. It's totally doable. Okay, but your best time is your first time. Okay, so do it like you mean it.
And you did tell me that I was going to pass before I even took the exam based on my scores.
Yeah, I already knew it. I said, don't worry about anything. You don't have to start anymore. But if you want to be like in the 99 percentile, 95 percentile and above, this is all what I would do at this time. Nothing else. You don't have to stress. You already
Yes.
passed. Yeah.
Yes, and you know what really helped me when you were saying towards the end of my 6 weeks, write it down, write it down. And honestly, what really helped me was, besides me having your flashcards, I created my own flashcards.
Yep.
3 days before my exam, and that's all it took, because I gained the knowledge by writing it, and I gained the knowledge by just going through my own flashcards 3 days
Yep.
before my exam, and that is what helped me.
How do you write?
Absolutely.
I'm sorry? Well, let me give you an example. I think I heard something. So I went to the dollar store. I bought some flashcards. And for example, the debit code, for example, I put the uses, labs, black box warning, and all those just basic information.
What's
Contraindications of
pancreatitis?
medication.
Yeah, what's pancreatitis?
Yeah.
What's the depot
Yes.
toxicity? What's the
Yes.
liver toxicity? The normal
That's
labs of 50 to 125, 150 is the
Uh-huh.
toxicity level. All that.
That's it. Signs and symptoms of hepatotoxicity, pancreatitis. That's it. And I went to the next one, which was lithium uses, labs, signs and symptoms, acute versus toxic. I mean, yeah, basic signs and symptoms of side effects of lithium versus toxic, and that's it. Then I went to the next one, like that, just simple, everything you need, and I went over them for the entire weekend, and that helped me out.
Gotcha.
It really did.
Thank you.
Yeah, you're welcome. And sorry, and I have one more news to share with you, Dr. Lopez, if that's okay.
Go ahead. Yes, please.
So I passed of course, my boards on Monday, and you told me, go celebrate with your wife.
Yes, I said that. Get something nice. Go
Yes,
to
you
a
did.
cruise or something
So,
big.
yeah, go have dinner. So tomorrow is our 1-year anniversary, wedding anniversary. So we're going to celebrate. Yeah. So tomorrow we're going to celebrate our anniversary and my passing the boards.
Congratulations.
Huge.
Yes. God's plan.
Yes, man.
It's God's plan.
Always is. It gives me goosebumps, man. That's it. Super excited for you. That's thanks for sharing your story. It's very important,
Thank
guys.
you, Michael.
very
This is your
welcome.
moment. Like I say, I can't say this. I guess I'll say it. It's like your wedding day. This is a special moment. You gotta look forward to this. Like when I go take the test, I'm like, yep, I'm happy. I'm like chilling. I'm just like super excited because that's the easy part. Because the hard part is the preparing part. Okay,
And that's
so
it. Pick your
yeah.
date. Pick your date, and that's it. Go based on that. If it's 2 months from now, if it's 1 month from now, then it's crunch time. Sit down and study. Put life aside for a month and just go for it. It'll be worth it.
Totally worth it. And plus, like I said, for most of us, you have 6 months. Do you need it? No. Yesterday we had someone that chimed in and said, hey, I came in, I didn't have enough money, and he helped me out, and I did this for a month, and that's all she did, and she passed too, right? So there is enough, there is more than enough in the course that if you dedicate yourself, you will succeed.
Yes, and this program is all you need, Dr. Lopez. Honestly, this is all you need. All the information is there. That's it.
Yeah. So yeah, that's awesome. So thanks so much for coming in today, and go celebrate your 1 year in university. Every once in a while, every 2 years, I stop at El Paso there, and I'll make sure you'll give you a ring. Maybe we can go out for dinner or something. So that's super
Absolutely.
awesome.
And that is a promise. That's a yes, definitely.
So you're now studying your psychopharm, right? Whenever you come back from to advance yourself and then get you a little bit more knowledge in there in some areas. And the psychopharm is so intense, like it's not a breeze. Okay, but you will gain if you put yourself now another 8 weeks. You will be prepared to challenge a psychiatrist in a respectful way, obviously, not challenging, you know, but you'll be comfortable with your conversations, right? You will be
Absolutely.
very, very comfortable. Like, hey, why'd you do this? So, like, I call it out many of them many times. Like, hey, do you mind explaining to me? Oh yeah, I totally. I don't go there. I'm like, hey, you f this up. I'm like, hey, help me understand. What are your rationale? I come from a humble place, and they'll catch themselves along. Oh man, I totally missed that out. Well, I just want to make sure. And then we don't want to ever be like calling people and telling them they are wrong or right, but they're like, hey, please help me understand what your rationale here. Oh, do you care to explain? So, and then they're like, oftentimes they'll catch their mistake, like, yeah, I totally messed that up. I said, well, I just want to make sure, I'm not missing something. But with that kind of knowledge, it brings a second thing, right? Is now when you go in the interview, you can say, I am worth it. You are not going to pay me this is small salary that you are offering because I am worth it. I will bring more value to the company, and this is how I will do it. Or sometimes you
Yes.
accept an offer, and then 3 months later, be like, hey, you see how I operate. You see how much value I bring in. Now I would like to renegotiate my salary. And they will do
Speaking
it.
of which, Dr. Lopez, speaking of
Yes.
which, I passed Monday. I updated my resume Tuesday. I applied for a job on Wednesday, and I got an offer yesterday.
There you go, man. That's what's all about. And then people say, is the investment worth it? It's totally worth it.
It is.
Totally worth it because
Yes.
it's nothing. It's nothing. It's like nothing, absolutely nothing compared to to how your life will change and how you. I mean, it's just emotional experience. To me, it is to each one of you guys that pass, and to each of you guys that unfortunately don't. I get my heart aches when I hear that I did not have success, and then we kind of gotta go back and say like, what happened? Are you anxious? What can we do to work the anxiety down? Can you be able to just calm down, like have trust and faith on what the work you have done? Now, the faith without the works, it doesn't go together, right? So we have to know when to test. Don't test too soon. Don't take it too long either. You have to find the right balance. 6 weeks is perfect time of intensity. Some people may need more, but what's the right time? It's only you can say it. What's the right time, right?
So
But
thank you very
yeah,
much, Dr. Lopez, for this time.
yeah.
And
So I look
I'm
forward.
happy to share my
Yeah.
story.
Thank you. I look forward to seeing your name there in the psychopharmacology, which I know you already enrolled, and getting through it. But that one is like a good cheese, a good glass of wine. You just got to go slow and savoring each way, visualizing the gains and how you apply on your day to day with your patients, visualizing situations that are, you know, that could happen. And we are formulating now a postgraduate program, kind of, in which we'll meet up twice a month. Maybe one time I'll do it. The times I'll invite somebody else to come do a talk, and that's it all stems from this program, and it's free too, so it's no charge. It's just for us to get together and learn together. So maybe you
I'm
can
looking
share
forward to
some,
it.
yeah, share some case of things that you've seen and how you dealt, and pass it on the experience to the other nurses as well. It's something on
Yes,
the
sir.
works. Okay, it's on the works. I know there's a lot of things on the works on my back, but it's something that I want to do and implement for all of you guys who are part of our course as well. Because as I mentioned, our relationship doesn't end here unless if you want to. Once you pass, it's totally okay to go on your own and do great things. But if you want to hang with us, we'll make this a community, something that we'll cherish and learn from each other. So
Great.
Absolutely.
right. Yeah, absolutely. So that being said, is any other questions, concerns, or anything that I can help you guys tonight, or anything at all that's in your mind?
Dr. Lopez, question.
Sure.
Oh, is there any way you could divide the WhatsApp group to those who already passed and those who are still studying? That way, I don't know. It might be a little bit because the people that already passed, that it might be boring for them. But whoever chooses to stay there can still stay there. But whoever doesn't can migrate to the one that's already passed, where you can offer more or the other networking.
Yeah. So I did that. So sorry that Hebo, I think your mic is on. There is a WhatsApp group for those that are passed. Okay. It's just I've been like 10 days post-op. I had a knee surgery, so I've been a little bit in the weeds here, kind of like trying to get things done. But there is one. It is already available. It's just I haven't done much in that group yet. But there is one. Okay. Senzi, and you have a question there? If you do, you can unmute yourself. Here you go. You have a question there, man? You're still muted though. While you unmute yourself, we can go on with Bridget. You have a question there?
Hey, I have a question. So I just joined
Sure.
today, and I just want to know where to start from to get started. I just finished on Monday, so I want to know
Oh,
how
okay.
I
So you
get.
just Yeah,
Yeah,
you just graduated on Monday, or?
Monday, yes.
Oh, congratulations!
Thank you.
Wow, well done, well done.
Yeah,
Do
thank
you
you.
mind? Do you mind? I mean, you don't have to. Where'd you go to school at?
Walden.
Walden, very good,
Yeah,
very good. So we do have a lot of students from Walden. I'll go ahead and then I'm gonna give you a discount too.
thank
Guys,
you.
this is not about money completely. I do need to pay the bills, but I'm gonna also give you a small discount here. Basically, let me see here. Let me put the code for you, and then I'll give you where to sign up. Glad that you are taking the leap of faith and joining our program. You will
Thank you.
succeed. Okay.
Thank you. Thank you.
Yes, absolutely. So yeah, I'm gonna put in. Do you know the chat box here on the right side of the screen? There is this there is this lock, there is this triangle, and there is a chat box next to it.
Let's see. That's my first time, so I'm kind of
Yeah,
like,
no worries. Well, thanks for joining us today. Hopefully you liked the Kahoot.
I do.
Oh, yeah.
Alright,
So,
so
you know, there was this group thing that I never tried. Today was the first time trying it. Um,
I'm on my
so
phone,
yeah.
so is it possible to do whatever you're saying?
Yeah, absolutely. You can do it on your phone.
Okay.
Sure. Let me just
Okay.
put it in here. So, just so you know, since you're the first time hearing from us, what is our program? It's a complete program. And what I mean by that is like other people will try to sell you question bank, other people try to sell diagnostic tests, LMRs, modules 1 through 5. So this is all included. So you
Okay.
get all of it. You get the
Okay.
over 1,000 questions. You get the crash course review. You get the complete review of modules 1 through 5. You get diagnostic tests. So basically, what I'm saying, it's all in one program, right? And this is what I really try to help people understand that this is not like I'm not saying, hey, buy this modules 1 through 5 for $400. And by the way, when you finish, you need this crash course review that's going to cost another $200. And by the way, we have this question bank that's going to charge you $150. And by the way, do you want to know if you're going to pass? Pay for the diagnostic test. And I know this is how most people operate. I try to put it in one package. I try to be sensitive that most of you guys are students and you do have a lot of student loans. I try to be sensitive to all that and try to kind of build you up as much as possible and give you everything you need. So, and there is unlimited classes. You can attend as many classes you want. Something happens in your life, you can pause. Like, hey, I need to pause. I'll come back in like 3 or 4 months. Completely fine. We're the yes
Okay.
people. We'll work with everybody.
Okay.
We'll try to. Okay.
Okay.
All right. So you can log
So
in
I
with a
saw a
link.
link. Yes, I saw a link that you sent.
Yeah,
So
and just click it now, and
okay,
they'll
now.
give you a code when you go down in the bottom, and you can use a nice discount as well. Okay. Sanchez, thank you for joining us. Appreciate it. Sanchez, can you unmute yourself? I know you're trying to say something, but you might have been muted.
I think your mic's
Okay.
not working. Oh, there it is.
Oh, okay. Okay, I don't think my mic is working. I am one of your new students. Recently signed up 2 days ago. I want to make. I am getting all the content, including into the WhatsApp group. So here is my phone number for the WhatsApp. Please, text me. WhatsApp via WhatsApp. This number does not work for regular text message. I have another number for text message, but I use WhatsApp mostly. So kindly please text me, and that way I can save your number to my phone number to my phone, and then I can add you to the WhatsApp group, and then we can go from there. Okay. Did I answer? Hopefully that okay. On Oh man, my eyes are getting pretty bad. Okay, got it. Thank you. All right. Then we have here Lillian. You have a question there, man?
Yeah, I
Thanks
have
for
a
joining our
question.
question bank.
I
Appreciate it. I saw
know.
your
Yeah,
text message.
it's kind of unfortunate that I got to your program really late because I'm testing next week. But
Okay.
I
So
was in. I just want to confirm to affirm what you say because I was in another program for a
mhm,
couple of months, and whatever you're saying is true. Like I spent a lot of money to be able
yeah.
to go through the test bank and all that. But um, uh, um, I don't know, for whatever reason, I popped into you on Friday.
Mm,
And yeah, so that's why I was like, let me just take the test bank and then just to
okay.
brush up, do as many questions, because I do well with questions more than even
Oh,
yeah, because I like to read the rationales and kind of just make it make sense to me and the wrong answer. So I
okay.
feel I'm
Go ahead.
okay. I mean, anxiety is a good thing. You can't go to it any test cocky. Um,
Yeah.
so I'm just hoping because there's so many other things at stake. So
Yes.
just
So is this your
reaching
first
out to
time,
everyone.
Lillian?
Yes, this is my first time
Okay.
testing.
So here's the deal. What I'm gonna do for you. Okay, I'm gonna give you the diagnostic test as well. I'm not gonna charge you anything. It's gonna be free on me.
Oh,
Okay.
thank you
So,
so
but
much.
yeah, I want you to just know this. Like when you are testing,
Mm-hmm.
1 week before you're testing, I want you to take the diagnostic test because if you're not, the truth is, if you're ready now, you are week from now is gonna do very little. Okay. So if you score an 80, go take the test confident with
Okay.
confidence. I'm gonna send you some PDFs as well so you can study, okay? Because
Okay.
I want you to pass regardless if you are in my course or not. It matters, but it really doesn't. I want you to pass regardless. So if you score an 80 on your diagnostic test, then go. I'm gonna send you some PDFs so you can study and then you'll be better.
Okay.
Okay. If you don't score an 80, then I would kindly request that you don't test it
Okay.
because your first time is your biggest chance. Okay.
Okay.
And it's kind of good to go there like feeling very confident. Now, if you score like 75, think with the PDF, the information I'm gonna send, you can still make it. Okay. So we're just gonna have to kind of work a little bit together, and I'm not charging you anything for it. So just email me, and as soon as I finish here, and then I'll send you the password and the things for the test bank. Since you bought the question bank, I'm gonna give you the diagnostic test and help you kind of maybe test it now since you already have the date for your test. Okay.
Okay, so that's gonna be in my email, you said?
Yes, but I want you to email me, okay? I'm going to put you my email address here, pmhnp@mpexamcoach.com. Just email me. So that
Okay.
way I have your email again, and I'll send it back to you, the information. But
Thank you
just
very much.
remember, if you're not ready yet, don't test it.
Okay.
Reschedule. And that's hard to say, right? But how do you know? Well, if you score 80% on the diagnostic test, I'm very confident that you'll be okay. And if you score close to that, I'm gonna help you out by giving you some PDFs to study along and make sure that you be up to speed by your test date. Okay.
Okay.
Alrighty.
Thank you.
Absolutely, my pleasure. Seashell, what is your question there?
Hello, Dr. Lopez.
Hi.
I missed out on the crash course yesterday.
Uh-huh.
I was just wondering if you recorded it and where I will find it. And
Yes.
also, I want to tell you, I am thankful for you allowing me to join this course so much in advance. I finished school with a GPA of 4.
Ooh, look at you. That's awesome.
Thank
Well,
you.
congratulations for finishing school. I know it's a huge deal, and I'm so actually happy that you joined early, right? So by joining early, it's less of a rush now. So you just now gotta finish it up, tighten up things, and then pass your board. And that's the way of doing it. Now, to answer your question, when you go to the course, you go to all trainings on the left upper corner of the screen. When you do that, there is another module that I added. It's called Module 11. Module 11 is all the lives modules 1 through 5 and the crash course review. So it's already available for you there. So it's available
thank you.
now.
Thank
Now
you,
you
Dr.
can, you can go through the recorded one that I did all on, or you can go through the live one, or you can go through both, right? But I'm looking at your stuff. I'm looking how much time you're spending on the course. I'm very proud of you. I think I have no doubts that you will choose to succeed. Okay.
Thank you so much.
Absolutely. Bridget, do you have another question there, man? I don't know if your hand
I'm
is
sorry,
still up.
no. No,
Okay,
I'm
all
sorry.
right. No worries.
I forgot.
No worries, man.
Mhm.
Shanika, do you have a question there, man?
Yes, I just want to,
Hi.
like, I get confused with IED and DMDD. Can you just specify?
All right.
Because they're both like intermittent, but one is more like that DMDD. Is that like age specific that makes it different? Or
No.
how do I differentiate?
ID, you know what we call ID in the army? It's a bomb. It's a uh, explosive device. So think of the ID as the kid that goes off like a bomb, right? But then they come back and be normal again, right?
Okay.
Now the other one, it's like a little kid with bipolar. They have mood, libido, their feelings, their attitudes kind of change, but it's not as explosive out of nowhere.
Okay.
Now, ID, it can also be diagnosed in adults, but how often do you see that? Never. But the book says it can.
Mhm.
Okay. So on the other hand, the other one would be like a bipolar like condition. So that's why we do not diagnose bipolar in younger children or 18, 17 and younger. Does it help a
So
little?
you would diagnose those children with DMDD.
DMDD, yes, ma'am.
Got it. Okay. Thank you.
Okay, absolutely.
Mhm.
Uh, Sanchez, do you have another questions, or is your hand still up since the last time? Oh, not Sanchez. Senzia. I'm so sorry. What's your name? While you write it down, we have Melissa. Melissa, you have a question there, man?
Yes, it has to do with your platform. I am doing the modules, and I
Yes.
hear you mention do the questions after the module. I
Okay.
can't find the questions. I just see the learning ones.
Right.
Where
Right.
can? Mhm.
So thank you for the question. That's a very good question. Basically, you have to go to another platform. Okay. The questions is not yet. It's not in the same platform. Um, Let me give it to you. You received an email. Well, most likely you received an email, should I say,
Yes.
uh, that offers you the question bank. Okay. So on the question bank, you are able to go through those over maybe 1,400 questions, 14. Yeah, it's a lot of questions. I don't even know how many uh, questions there. One
Okay.
second.
I have to
So let
check my.
me, yeah,
What
check
would
your
be
email.
the
So
subject in the email?
I I don't know because it's an automatic email that you receive, and most likely is on your trash bin. But you can search NP exam coach and
Okay.
look especially in the trash bin. It should give you where to go. It's a different website, and you already, since you already signed up, we signed you up. All you need to do is log in. You don't have to create an
Oh,
account.
I see it.
And
I see it.
by the way, do not buy anything in that website. Do not buy anything because you already got everything.
Okay.
Okay.
I
And it's
see
going
it
to
now.
say, yeah, it's going to say, would you like to buy diagnostic tests? You say no, because all your other information is on the other website, which is already part of the program. This one
Oh,
is an older website that I had, but my question bank is still there. Okay.
okay. Sounds good. Thank you so much. I see it.
Yeah, my pleasure.
Okay.
Um, uh, Reiki, do you have a question there, man?
Yes, thank you. I do. So I am like in my account, the PMHNP review course 30-day walk into success. And on the left hand side, because I've heard you talk about the diagnostic test. So I'm looking at it and it says 100% completed. I don't recall completing any
Okay.
test.
Do you mind sharing your screen? So you do that by let me stop on 1 second here. Let me stop sharing so you can share your screen. 1 second, please. So that way I can see what you're seeing and makes it a little bit easier.
Yeah. Okay.
1 second, please.
Sure.
All right. So I can now stop sharing. So you can go to where it says here on the Google call. You can go next to there is uh, the phone call. There is three dots. There is the hand, and next to it should have a arrow point up that says present now. You click on that, and then you pick the screen that is for the course, and then you can show me what you're seeing there.
Okay. Let's try it this way. Can you see this?
Um, I don't think so.
Okay, I'm gonna have to figure it out. That's fine.
No, no,
I'll
it's
work on it
um
on a different tab. You know what I mean?
okay. So
So the
let me
linking is
show you my tab what it looks like, and you let me know if it's the same. Okay.
okay,
So
because I don't have
so
two
y-
screens.
yeah. So so what you're saying is that you took the diagnostic test. Is that correct?
No, I did not. I don't recall taking the diagnostic test, but it's showing me as I completed it, like 100% completed. But I
Okay.
didn't take it anymore.
Now, are you allowed to complete it again?
It
Can
should.
you?
I think so. Yeah.
Yeah. So go ahead and click it again. Now, let's say that for some reason the system is not allowing you to take it again. Email me, and then I'll go ahead and give you a link, and should be able to do it. So, what's important? I mean, what's nice about the course is that when you complete something, there is the little dot that you plug in and say, "Hey, I have watched this video," and they will give you points. The points is supposed to be a dopamine hit to get you hooked on, like, "Hey, I'm getting a little points, getting somewhere here," and also helps me to see where you are. So make sure you collect all your points after you send your video, so that way it helps me to following up. Like, hey, you actually complete 80% of your test of your program. Because some people are like, oh, I'm testing tomorrow, and then I go see where they at, and I see like 30% complete. It's like, oh my god, I don't know if we should test it now. So it helps me to figure out where you are in this process, but it also helps you by giving you what I call the dopamine hit to help stay motivated. So
Okay, that sounds good. Yeah.
okay, so my email is
Yeah,
pmhnp.
I got your email. Perfect.
Okay, great.
Thanks.
Thanks.
Okay.
And Sanchez, can you search? I keep calling you Sanchez. I'm so sorry. Senzia, can you possibly search for MP exam coach and then look at your trash bin, and then you should see the other website for your question bank. Okay, while you look for that, I'll go on with Melissa, and then we'll get back to you. Okay. Melissa, what is your question there?
Sorry about that. Yeah, I found your email. I'm on the website where the question bank is, and I know you
Okay.
said don't sign up.
You
But
gotta sign in, right?
I you
Don't
know
see
what?
it?
Never created a password or anything, because when you did it,
But
you sent
oh
me
yeah.
a link in the email, and that's what I always use to log in.
Well, yeah, but the link to the email is to another website. This is a
Right.
totally
Oh,
different
so
one.
I have to
Y-
create a
You,
profile.
I created your profile, so
Oh,
you can either say forgot password, and then it will send you another one
ah,
because I
okay.
already signed you up.
Okay. All right. I will try
Yeah.
that then. See what
Yeah, and
happens.
if you have problems, email me at pmhnp@npexamcoach.com, and we'll walk you through. We'll give you a call back. We can do this one-on-one and try to figure it out. Okay?
Thank you.
Absolutely. My pleasure. Sanchez, do you have a question there still? No? Not Sanchez. I'm so sorry. Senzia. If you have I don't know, I keep calling you Sanchez. So sorry. If you have a question, please let me know. I know you haven't been able to talk. Here we go. Diagnose test one. Perfect.
Yes.
So, okay, if you scroll down,
Mm-hmm. Okay. Mm-hmm.
down, not on that part, but the other part on the right hand side.
Oh, okay.
Yeah. So just stop that 1 second. See, that's the link for your
Okay.
test. So you just
So
click the link.
why is it telling me here that I did it 100% completed? Because I'm like, right?
Yeah, let me see. I'm trying to see. I'm not sure. Maybe you clicked on the done before. It should have say only completed when you click the done. If you click the done here, it should say a little. Yeah, go ahead, click that. Just for
Does
so
that
we
just
can.
one, this one,
Yeah,
the done part.
yeah. So
Okay,
it
so that.
gives you points. So now you can go back and unclick it, so that way you know that you're not done. So we try to make it fun. Maybe a little
Yeah,
bit too
I
much
love
at
it.
times.
Yeah.
So
Awesome.
yeah, so you can just click the link and you can take as many times as you need. Now, because this is your first time taking it, just take once and do not look at the test, because you are going to retake the same test later. And then later, you can see how much you have progressed. All you care now is to know, hey, I scored 50%, 45, 70. You don't want to look at the test. You don't want to invalidate that. Okay? So you take it and leave it. Don't look at fight the urge to look at the answers. And then you as you progress down, keep going down one more time on the screen.
Okay.
No, on the other side. Yep. Keep going down, down. That's when you begin your first class of module 1, and that's when your training begins.
Okay. Cool.
Alrighty?
Perfect.
And then after that, you just keep going down one by one. Now there are, if you should 1 second, if you go up now for me, all the way to the up, yes, please. And let's say you are somebody that like to be stressed. You want to see all the trainings available. You don't want to one by one. Why do I do one by one? Because I don't want you to be overwhelmed. But let's say you like to see all the trainings. You can go to all trainings on the right hand side there, left hand side of your screen. No, the other one.
This one?
No, the other one. In the middle. Yep.
Okay. This one?
That's toward up. Where
Okay.
it says
This is, yeah, that's up. That's,
yeah. So now see the three, yeah, all trainings there. And let's say you're like to see everything, right? So now you have on module 1, there are 23 modules on module 1. Module 2, there are probably, I don't know, 20 or something. So now you see all your trainings to complete, that it's there for you.
oh, this is so helpful. Thank you so much. Okay.
Yeah, I just don't like to show that because some people are like, oh my God, I got to do all that.
No, that's,
Well,
yeah.
for some people it's okay, but some people it's not. But if you follow the first screen, it will go each training one by one for you. Okay.
Okay. Starting
So
from here, scientific.
yeah. So if you do the same thing, now you have module 2, 3, 4. If you go down 5, and then crash course review, module 6.
Wow.
Okay. So all you have to do is listen to one lecture, and then the next one will appear little by little. Now, actually, I want to show you one more thing since we were discussing this. Such as if you go in the first training of any of the modules, modules 1, 2, 3, or 4, the first training. Yeah, let's say that module 1. Okay. And click on the first training there, please.
Okay, so I've already
Uh,
completed
uh,
the first 3. Okay.
Now, the first one. Now go down. That's your video there, right? That's when you begin your video. But look at what's under the video. It's your PDF. So under the first video under the first training of each module, there is a PDF there. So your PDF, if you download the PDF, you didn't download on top. See the under the video, but are you able to download it?
Yeah.
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 Okay.
I can download it. Yeah, I just did it. Not
Yeah.
yet. I don't do that right
Okay.
now.
Yeah. So you under each module, the first training of each module, there is a PDF. So the PDF will cover all the topics for the module in written format. So that way, as you watch in the lecture, you are also following along with your PDF, right? The second thing I want to say is that, like, say, module 1, you will not get a 5 hours training. You will get 23 small trainings. They might be 5 minutes, they might be 20 minutes. So that way it will help you keep you hyper focused on what you need to know, rather than giving you 5 hours, because nobody wants to listen to me for 5 hours. Small little training, little at a time. Go get a cup of coffee, walk the dog, and come back hyper focus again. Okay.
Amazing. Wonderful.
Yes.
Thank you so much. Okay.
And if you encounter any problems, please reach out. Okay.
You're the best. Thank you.
Oh, no, I'm so glad that you took the time and you joined our program. And yeah, super stoked.
You're amazing.
Okay.
Thank you.
Thank you. All right, everyone. I don't want to keep you much of your time. Lillian, please make sure you email me and I'll get back to you with the diagnostic test.
No, I already
Anyone?
did.
Okay, great. Anyone testing soon? I know we just completed one cycle of go around with the life before. Everything you need is done for you on the recorded portion. But now I added the unlimited live classes. That means you can attend as many live classes, you can have as much interaction. We just finished a go round between crash course modules 1 through 2, 3, 4, and 5. And then we started module 1 again next Friday. If I'm not mistaken, if it's not a holiday, right? So next Friday. But I sent you all the schedule so you know when there's the next module. Next time we meet will be module 1. And then we'll go module 2, 3, 4, 5. Crash course review. Start with module 1 again. Okay? So with that being said, I wish you guys a super restful night. Take care of yourselves. Be always kind to yourself. Never talk bad about anyone else, but especially about you. You deserve it, to be happy and have the best life. I'll see you guys next Friday, okay, for the live course. Whatever it is in the calendar. I don't remember if it's Friday, it's a holiday or not, but
It's
see you
not.
guys later. Okay, so I'll see you guys next Friday then.
Friday.
Thank
All right,
you
guys.
very much. Good night.
Good night, guys. Take care.
You have a good evening. Well, good morning, Dr. Lopez. We'll keep in touch.
Yes, we'll definitely keep in touch, Michael. Take care.
Thank you. Okay. Bye-bye.
Bye bye.